about right now, first thing on our list is configuring and using prescription Rx defaults and med lists, okay? So open up on the button bar at the top, okay? There's a prescription button, Rx. Go ahead and click on it, yeah. This is what the prescription pad looks like, all right? And this is where it might be good to have Kim here.
Okay.
But is she available? Is she in the room? Is she?
No, she's not back till tomorrow.
Okay, well, let me tell you what we're going to do. This is how you look up a medication, okay? And this is, so if you were going to look up amoxicillin, you could put in AMOX, hit look up, and this is your drug list, your med list, okay? So we're going to say, okay, we're going to choose 250 milligrams of this amoxicillin. Now, this is your take field. How are we taking it? This is the frequency. This is the route, duration, right? Refills allowed. This here is a drop-down that tells us what are we doing with this prescription. Are we printing it locally immediately? Are we transmitting it electronically? Are we e-prescribing it? Are we faxing it? Was there a sample given? Or are we putting do not print because we're just adding it to a patient's chart, okay? If in most cases, we're going to say do not print here just to show you. Formularies come across here, notes, and the pharmacies will end up coming across here. Here's your extended SIGs, and this is what I want you to look at here, okay? Because this is what we're going to be, these are your defaults that we're adding. So use extended SIG, use patient instructions, right? Substitutions are okay. I always say update the progress note, but that's up to you guys. Allergy checks, drug interaction checks, limit refills. These are the ones that we're going to be talking about here in a minute, okay? So I always like to show people that before we go into it. So now we're going to go back to the dashboard because that's where we make all of our changes, right? And I want you to go to maintenance. I'm going to let you drive. Configuration. Prescription defaults. Okay. So this rx.cfg, this is the file format that we use when we're printing or e-prescribing electronically your prescriptions, right?
Okay. So this is going to set those fields that we just looked at.
Yes.
Okay.
Okay. So this here, are they going to be e-prescribing most of their prescriptions?
I hope so.
Okay. So you might want to change those to transmit immediately.
Been trying to get them to do it. It's been easier just to print, it seems, but.
Or transmit as a group. Now, just because we default transmit as a group is probably a better option.
What's the difference?
The difference is I'm a diabetic and I come into your office. I'm not getting one prescription.
Okay. So
you're writing 5 of them for me.
A group for one patient.
Yes, a group for one patient. Okay. So, you know, I would, having said that, let me tell you that anything that you put in here on these defaults, 1, you can change, and 2, can be changed on the fly.
Per patient.
So just because we have a, per patient. So just because we put it here, it's kind of a time saver to do this, but when you're in that prescription pad, you can change it at any given moment.
Okay.
Okay? All right. So go ahead and let's transmit all those as a group.
Oops, wrong one.
Okay, so let's go to the RX default tab now at the top. All right, those are those little boxes I showed you, right?
Right.
So right now, I think the most important thing is the allergy check is important. If you want to check food allergies when checking allergies, you can check that as well. Require a reason for drug discontinuation is usually checked. Requiring a reason for warning override absolutely should be checked. Progress notes should be absolutely be checked. And number of days back for formulary data, you know, you can leave it at 7, or you can go back 14 days to see if this drug has been prescribed earlier. So, okay. So let's go to drug interactions. These are set. This is the drug interaction check, and it kind of gives you a minimum level of severity to display, a minimum level of documentation to display. These are set at what most offices choose, but if you do the drop-down, you can see that they're kind of in the middle, and you can change those. I would talk to Kim before you change those, but you can see how, you know, this one's 3. It's right in the middle, right?
Right.
It's really going to be up to the doctors what level of documentation or severity they want to see.
They may not understand that till they get started.
That's correct.
Yep.
Now, required RX fields. I check, you know, you want to know the size, you want to know the take, you want to know frequency, duration, amount, you know, I would put refills and route. I check all of these, because what this is saying is that in order for a prescription to go out, all of those things need to be What are you looking for?
I'm just making sure it's all in here so I can read it later if I need to, like what's route.
Oh, route. Here, I showed you that, but yeah.
Okay. Okay.
Remember when I showed you on the prescription pad, you know, where it said how often are you taking it, right? What's the duration that you're going to be taking it? What's the amount you're going to be taking, right?
Right.
30 milligrams, okay? This is just saying that these are required in order for that prescription to go. So if it's missing a field, it's not going to go.
Okay.
Okay? So now we're going to go to frequency defaults. Now, this is a real easy thing to change or to add things to. Most of them are there. Okay?
I see.
But
okay.
if you wanted to add PRN, you know, as needed, go down to the next space and just type in PRN.
Is it lowercase or does it matter?
Doesn't matter.
Okay.
Okay? Now, there is a PRN check button next to this box, but I'm showing you how easy it is to add it. It certainly doesn't matter whether it's here or there. Okay?
Okay.
Okay. So now let's go to other checks. Now, this is the drug disease check level. You know, so that's if, you know, this person has diabetes, you might want to be cautious when you give them a steroid, right? Because it's going to send their blood sugar crazy. Okay? So precaution is always a good check there. Now, age of problem to check for drug disease in months, most of my offices move that to a 6.
Yeah, that seems pretty short.
Yeah. Now, drug dose. There is drug dosing available. This will tell you, this will do it, you know, you mark it if you want a drug dose check. You want to, if you want a warning for that adult dose checking is not available, you can check that. If you want a warning to come up if geriatric dose checking is not available, you can check that. If you want a warning to come up that says, you know, there's not a pediatric dose checking here. You know, so if you're giving this to a, you know, a pediatric patient or an infant patient, we can't tell you what the correct dosage is. That warning would come up.
Okay.
Or warn about recommended dose. Okay, so you might want to talk about those with Kim.
Yeah, we'll do.
Okay, that's going to be an important thing there. So you can go ahead and say okay.
How do we get to this again? Maintenance.
Maintenance, configuration, prescription defaults.